Hello, my name is Barbara Taylor and I've written a book, The Last Asylum, which was published in the United Kingdom a year ago and in Canada last August. It was very difficult to anticipate the reception of this book, and I was nervous about it because it's a very personal story that I tell. And I was very pleased, as writers are, when the book received a lot of interest, media interest, lots of press reviews. I did lots of interviews, and I think what made it much easier for me was that immediately the warmth of people's reactions to the book. When one writes a book as intimate in its account of mental illness, as this one is, it can feel, I think, a little bit perilous. And I was steeled for mixed reactions. And in fact, they haven't really been very mixed. The book seems to have resonated with a lot of people, and I've had many conversations. I think the way I would describe the book's reception would be mostly in terms of conversations from which I've learned an enormous amount over the last year. I've had a tremendous sense of discovery since the publication of the book about what is going on for people in Britain, and not just in Britain. I'm also starting to hear back from people in this country as well. I think the sense of voices that have not been heard enough, people who either are suffering mental health problems themselves, or whose families, loved ones, friends are suffering mental health problems, who are extremely concerned about the care that they or their loved ones are receiving. Those people have wanted to talk about it. Some of them have wanted to talk to me about it, but they've also seized the opportunity to talk to each other in settings where my book was being discussed, and to try and deliver messages to policy makers about the tremendous deficit in mental health provision these days. In the UK, it now means that one of the only ways to be able to get inpatient treatment is to be legally detained, which has actually pushed psychiatrists into a position where someone who doesn't require legal detention, they have to detain them simply in order to ensure that they are able to find a bed for them. In the United States, the three biggest mental health providers right now are prisons, and the proportion of the prison population suffering from mental disorders, in many cases untreated mental disorders, is enormous. There are also in the UK now, prisons are being used as so-called places of safety for people who are in mental health crisis. Children are being put occasionally in prisons as holding places for them when they're having breakdowns. I'm looking forward to my book being published in the United States. I find it very hard to anticipate the reaction there. One of the big themes of my book is I personally recovered through a long-term psychoanalysis. Psychoanalysis is not in fashion in the psychiatric establishment in the United States. It's not in fashion in the UK either, but there is more support for it in the United Kingdom than there is in North America. And I include Canada in that, as well as the United States. And I don't know how people are going to react to that. I think the elements of the book which are critical of the current state of mental health services, I mean, we'll see what sort of reception that gets. The prize obviously is giving the book much more exposure than it's had in Canada thus far. And I'm very excited about that, because I think that there are conversations to be had here in Canada. I'm a historian, and a big element of this book also is a historical examination of the asylum system. And I'm now writing a very different sort of history book. I'm writing a history of solitude in the 18th century. I'm Barbara Taylor, and I'm the author of The Last Asylum.